Ahora sí, ¿cómo están? Buenas noches. Hola México. Hola Argentina, está en la casa. Diana Parra, qué bueno verte. ¿De dónde me escriben? Hola Argentina. Venezuela, ¿de qué parte? Borges, un abrazo, 19. Hola Morsa 0609, ¿cómo están? Qué placer verlos. Estamos a punto de iniciar nuestro encuentro con el doctor Stuart Nunley y la doctora Lane Freeman. Juan, qué alegría verte. Argentina presente, México con la doctora Correa presente, San Cristóbal, Venezuela. Un fuerte abrazo, Guerra, Guanajuato, México, Claudia, Allá, Quesada, hola. ¿Cómo están? Buenas noches. Estamos muy emocionados, hay muchísima expectativa con este encuentro. Han hecho un trabajo increíble. Estamos a pocos minutos de empezar. Nena is in the house, Argentina, Maracay desde Venezuela, Estado Lara, Venezuela presente. Dani, ¿de dónde nos escribes? Buenas noches para ti también. Chile, Houston, Texas. Hola, qué bueno verlos a todos. Chile, abrazo desde Viña del Mar. Yo me operé con la doctora Freeman y es lo máximo, dice Mari Carmen Barroso. Albany, New York, presente, Argentina. Apure para abrir los ojos viendo a estos dos magníficos, dice Apure. Un abrazo a la Sabana, Atlanta, Argentina. Feliz y bendecida noche. Un abrazo para todos, a Caribbo, Venezuela, San Antonio de los Altos, saludos, Autry, Orlando, Florida, Miami. Estamos a pocos minutos de empezar, faltan 3 minutos para el gran encuentro. Colombia, Canadá, Alfred Allende está con nosotros, Barquisimeto, Venezuela, Argentina. Qué buen encuentro el que estamos logrando esta noche con el doctor Stuart Nunley y Lane Freeman. Hola New Jersey presente, Montevideo, Uruguay, Argentina, Medellín. ¿Dónde estás? España, estás trasnochado. Paraguay, faltan 3 minutos todavía, estamos a 3 minutos del gran momento. Sonia Rojo está con nosotros, México presente, Yolanda, Florida, Paraguay, Barcelona, Venezuela. Abrazo. Me están pidiendo que desactive los comentarios. ¿Quieren que desactive los comentarios? Hola. West Palm Beach presente. El doctor Augusto Cura desde Chile, con muchísima expectativa en este live. Nos manda un saludo, un abrazo para ti también. Vanessa, qué felicidad poder ver de nuevo al doctor Nunley. Una experiencia brutal. Vanessa nos manda un saludo también al doctor Nunley. Jordana Ceballos está con nosotros. Llegó el momento, doctor Ludwig Johnson, doctor Stuart Nunley, Lane Freeman. La cita es con ustedes. Panamá, linda. Hay gente de todas partes en estos momentos. Estamos a solamente 2 minutos de dar el inicio del encuentro. Está con nosotros Stephanie, presente desde Perú. Está desactivo. Me están pidiendo que desactiva. Me dicen que no, me dicen que sí. Zulia, Venezuela, abrazo. Solo para escuchar, sí, piden que desactive. No lo vamos a hacer todavía, vamos a esperar a hacer la introducción y vamos a desactivar más tarde. Por cierto, nunca he desactivado comentarios, ya veremos cómo se hace eso, para que no haga ruido. El doctor Salvador Itriago está con nosotros, pone abrazos, dice espectacular en mayúscula, no, va como lee, dice Rubén, los abuelos, hijos, nietos, todo el mundo presente, un like para la posteridad. Así será, amén, que llegue esta información a todos. Gracias a ustedes por haber invitado a sus familiares, a sus seres queridos, a la gente que les importa. Han hecho un gran esfuerzo y va a valer la pena. No pienso que exista algo que tenga más impacto en la salud tuya, tú, que ya sabes muchísimo, que la información que vamos a compartir ahora. Información nueva, fresca, seguramente útil para ti y los tuyos, para tu herencia, para tus hijos. Información que fue sepultada, callada desde hace más de 100 años y con la que muchos de ustedes han logrado sanar. Se los debía, es el gran momento, es el encuentro con el doctor Stuart Nunley, Lane Freeman, dos seres de luz. Cuando los vean van a entender por qué se los estoy diciendo. Va a ser un encuentro brutal. Estamos a 1 minuto de las 8 de la noche. Dice, después de los 60 se puede recuperar más. Saludos Perú, Lima, abrazo. ¿De dónde me escriben? Cuéntame en qué parte estás. Hola Victoria, un abrazo desde Venezuela, Puerto Ordaz. I'm in the house and ready, dice Berta. Un lujo, Doc, gracias. Ojalá se conecte el planeta entero. Doctor, dejarás grabado. Preguntan, bendecida noche, bendecida noche. Pancho está con nosotros desde México. ¿De qué parte de México me escribes? La herencia para nosotros, gracias por abrirnos los ojos. Estamos a punto de invitar al doctor Stuart Nunley y a la doctora Lane Freeman. Un gran momento. Muy bien, voy a darle la bienvenida a todos ustedes que son nuevos en este canal, que fueron invitados por mis seguidores y que por primera vez se están conectando aquí para escuchar las palabras que el doctor Stuart Nunley y la doctora Lane Freeman tienen que decir. Y la razón por la cual los he invitado es para que nos expliquen cuál es el secreto. ¿Por qué hay pacientes que con esclerosis múltiple, por años con sus médicos y dentistas, con artritis reumatoide, por años con sus médicos y dentistas, con lupus eritematoso sistémico, por años con sus médicos y dentistas, con neuralgia del trigémino, por años con sus médicos y dentistas, pacientes con Alzheimer, pacientes con arritmia, por años con sus médicos y dentistas, pacientes con neuropatía de origen desconocido, por años, una vez más, con sus médicos y dentistas, después de visitar al doctor Nunley y Freeman, sanan. ¿Qué saben ellos que nosotros todavía no conocemos? No sabemos ni diagnosticar y muchísimo menos tratar. Hoy nos vestimos de manteles largos en un momento muy importante en la vida de cada uno de nosotros, que hemos perdido seres queridos, que hemos sufrido con ellos enfermedades incurables, donde la genética, el estrés, la edad, la mala suerte son las que han jugado el mayor rol, porque no tienen cura. Estamos hoy felices de poder llevarles a todos ustedes 3,000 personas ahora en una noche donde el Super Bowl lo vamos a hacer nosotros, al doctor Stuart Nunley y Lane Freeman. Ya son las 8:03 y para no hacerlos esperar más, quiero leer rápidamente el currículum de ambos. Esta entrevista va a ocurrir en español y en inglés. Va todo el mundo a entender el mensaje. La vamos a llevar en ambos idiomas. Y en estos momentos voy a comentarles sobre el Dr. Nunley, Stuart Nunley. Is a graduate for the University of Texas Health Science Center Dental School in San Antonio. He maintains his biological dental practice in Marble Falls, Texas, where he and his partners have treated patients from 50 states, all the 50 states of the United States, and 47 countries from all over the world. Dr. Nunley is chairman of the Jawbone Osteonecrosis Committee of the International Academy of Oral Medicine and Toxicology. He holds fellowships in the Academy of General Dentistry and in the International Academy of Oral Medicine and Toxicology. Dr. Nunley is board certified in naturopathic medicine and is board certified in biological dental medicine. He's licensed in intravenous dental medicine. He is a member of the American Dental Society, and he serves on the teaching of Faculty Academy of Comprehensive Medicine and the American College of Medicine and Dentistry. Ahora, rápidamente en español, el doctor Nunley está en Marble Falls, tiene su clínica, está graduado en la Universidad de San Antonio en Texas. Su clínica está en Marble Falls y desde ahí ha visto pacientes de todos los estados de los Estados Unidos, de los 50 estados y de más de 47 países del mundo. El doctor Nunley es presidente de la Comité de Osteonecrosis de Mandíbula de la Academia Internacional de Medicina Oral y Toxicología. El doctor Nunley está certificado en medicina naturópata y medicina holística integrativa. Sirve como profesor en todas estas academias y va a estar con nosotros. Está ahead of the curve in every aspect of what I call brave medicine, the medicine, heart medicine of the future. La doctora Lane Freeman tiene muchos años trabajando con él, también graduada de la Universidad en San Antonio. Ha llevado muchísimas horas de educación en el campo de la biología dental y está certificada en sedación consciente intravenosa. Está acreditada por la Academia Internacional de Medicina Oral y Toxicología. Es miembro actual del Instituto de Implantes Americanos de Odontólogos y la Asociación Americana Dental y del Corazón de Dentistas de Texas. Sin más esperar, vamos directo a invitar ya al doctor Stuart Nunley y Lane Freeman. Vamos ahora mismo a invitarlos. Ya estamos aquí, los amos son ángeles en mi vida, estoy agradecida, dice JJ Ceballos. Amén, amén, gracias por todos los mensajes. Tania Anzola está con nosotros. Dr. Nunley, if you're there. Dr. Freeman, if you happen to see the message that I just sent you, just click on it and we're ready to go. Vamos a ver si Dr. Nunley y Lane Freeman, si ustedes los llegan a ver, por favor déjenme saber para comenzar la entrevista. Todo el mundo pendiente de la vida y la salud no tiene precio. Hola, soy testigo de esto, la verdad. Ludwig Johnson, Nunley Owens, me curaron. Estamos a punto de dar inicio. Una vez más vamos a invitar al doctor Nunley. Vamos a ver ahora si puedo hacer clic y vernos. Dr. Freeman, if you're there, just say hi so I can click on you, either you or Dr. Stuart Nunley. Hola, dice Bolivia, saludos. La clínica más espectacular en un lugar tocado por Dios, tratan tu cuerpo como tesoro. Yo no lo puedo explicar, es un lugar estupendo, me sentí espectacular después de mi operación, antes y después. Dice Vanessa, Sonia hace aplausos. Wendy Glass dice, este live pregunta si será guardado, si será maravilloso, dice Dani. Cecilia, no logramos ver, si llegan a ver al doctor Stuart Nunley o Lane Freeman, ya está, me dice Maribel, comenzó a seguirte, me dice Caro, ahí están, dice el doctor Salvador Itriago, todo el mundo los está viendo, yo no los estoy viendo. If you guys happen to be there to say hi, give me vamos a ver, una vez más vamos a volverlos a invitar. Están diciendo hi. I don't see them. I don't see you guys. Once again, just give me a big, huge hi. Ya está, no los veo. Dicen hi, dice el doctor Salvador Itiago, pero yo no los veo. Vamos a ver. Aquí está. Ahora sí. 3.900 personas para dar inicio entonces a nuestra entrevista el día de hoy.
Are we?
We made it.
Oh,
How-
that's great. Oh,
So,
thank you.
Dr. Nunley, Dr. Freeman, thank you for being with us tonight.
Thank you for having us.
We're delighted.
Listen, there's tons of people gathered here to see how come, what's the secret? People with MS, Hashimoto's, trigeminal neuralgia, people with their own medical doctors for years, they go to your place and they heal. Aquí hay muchísima gente reunida esta noche para ver cuál es el secreto. La gente con hipotiroidismo de Hashimoto, neuralgia del trigémino, lupus, artritis reumatoide, por años con sus médicos y sus dentistas, van a la oficina de ustedes y se curan. ¿Cuál es el secreto? But before we get into that, I just thought it'd be nice to go back in your story. Life seems like a story tale sometimes, and there are some aha moments in life in which something happens and you literally change the course of your destiny. What happened in each and every one of you that made the change to start working outside the box, or what you call biological dentistry, or what I call hard, brave, true medicine? Pero antes de llegar a hablar de eso, yo quisiera que por favor entráramos en la historia de cada uno de ustedes. ¿Qué pasó en la vida de ustedes en el pasado que empezaron a tratar la medicina fuera de la caja, a ir en contra del sistema, a hacer lo que ustedes llaman medicina biológica?
Well, it's a great question because truly I practiced very traditional dentistry for the first 20 years of my practice, even though I considered myself holistic because I knew better than to put mercury fillings in my patients. But, you know, I got sick 22 years ago, and it looked like I had a very disabling neurological disease. We thought I had ALS. As it turned out, I had a mercury toxicity issue, which was primarily from, even though I had not put a mercury filling in many, many years, I had been removing them without taking precautions. And so a dentist who does that literally sits in a little mercury vapor fog all day. And some of us, as you know, don't detoxify mercury well. And so it finally caught up with me. And as you know, I went to Montreal for treatment, and I was very much influenced by the gentleman who treated me. His name was Hal Huggins. And as a result of that, our practice was transformed, and we began on this steady road of trying to provide patients with the truth as we know it, and with dealing with the whole body rather than just the mouth.
Yo le estoy preguntando al doctor Nunley qué pasó en su historia que hizo que él cambiara la dirección y empezara a hacer la medicina biológica, la odontología biológica. Y él cuenta que él era un odontólogo tradicional. y que hace 20 años él pensó él tenía esclerosis lateral amiotrófica y estaba con muchísimo miedo y fue a Canadá y tuvo la suerte de verse con Hal Hoggins, un odontólogo biológico de quien aprendió muchísimo en ese momento y resultó que no era esclerosis lateral amiotrófica, era toxicidad por mercurio. Eso era lo que tenía el doctor y aprendió entonces y eso cambió su vida. Él era un médico, un dentista tradicional y con Hal Hoggins tuvo una diferente visión de su odontología. Dr. Lane Freeman, what about you?
Well, I have been very fortunate and blessed that I came into this not because I had a major health crisis, and I feel like that was a blessing, but
Dr. Freeman, I'm sorry. They're telling me to just
can't
stop all these messaging. Do you know how to stop these? I don't know how to just cancel all these messages. Should I click on, you guys have
I think you have to do it. I think you have to.
If there's anyone out there that can tell me how to do it, si alguno de ustedes sabe cómo quitar los mensajes, por favor que me diga. I just don't want to mess it up. This is actually I don't want to click and you guys
I don't know how to turn them off. I think you have to do it because it's your video.
Oh, it's definitely me, yeah, for sure. But the thing is, so many buttons here. So, yeah, I'm pretty sure someone's going to come up to tell me how to do it.
I was going to say, I think someone will.
Por favor, díganme cómo silencio los mensajes. Enséñame, por favor, tú que me estás viendo, hay 4,285 personas aquí. ¿Cómo desactivo los comentarios? ¿En dónde se hace clic para desactivar los comentarios? Try on settings. Block on comments. Okay, got it. We're good to go now.
Really?
Oh, it's just the three of us.
Oh,
that's good.
Ya estamos perfectos. Somos solo nosotros tres ahora. Okay, Dr. Freeman, I'm so sorry. Please
no, that's okay. No, that's okay. No, as I was saying, I didn't have a health crisis, but I was fortunate enough to work with Dr. Nunley as a baby. When I was in high school, I've been his patient since I was 5 years old, and then in high school worked here, and then became interested in dentistry. But then after I finished dental school, I happened to come back right at the time that he got sick and left to have treatment. So I got to be here right as he came back with this whole new wealth of knowledge, and I got to start out like that from my very first days of being a dentist and really relearning how dentistry interacts with our health. And so that was my story of coming into this, and I've gotten to walk alongside him as we've been on this journey of really getting to work with patients from all over with all different health issues and educate ourselves and educate patients on how their oral health is affected by their overall health and vice versa.
La doctora Freeman nos cuenta que desde mucho tiempo, desde chiquita, conocía al doctor Nunley y bueno, ella estuvo ahí cuando el doctor Nunley regresó hace 20 años y cambió toda su odontología y pudo crecer con él y prácticamente desde el inicio empezar, cambió después de graduada su mentalidad en la odontología. Well, you such a lucky one to have had that opportunity. Absolutely. You know what I'm thinking? Because a lot of us, we have those aha moments in our past, but mostly it's because of our personal story or because of a patient that makes us shift in our journey. But you were born literally there. Absolutely. Yo le estoy contando a la doctora Freeman que qué suerte tiene que el doctor Nunley la agarró desde chiquitica, apenas se graduó, la agarró, porque para muchos de nosotros es algo personal o es un paciente que viene. It's not every time, you know, people ask you, where do you study? Where do you go to school? As if you were taught something different. It's the same pensum. It's the same academy. It's the same learning everywhere. When you started thinking out of the box, you learn it from mentors and from things that are sometimes not allowed to being spoken aloud. Y yo le digo a la doctora Freeman, la gente siempre está pendiente, ¿y dónde estudiaste? ¿Y tú qué hiciste? Pero el pensum siempre es lo mismo. En realidad uno aprende porque un paciente te cambia la vida o por una experiencia personal que te cambia la vida. And you do your own research when that happens. Pero la doctora Freeman had the opportunity to have a mentor next to her. She was Little. Pero la doctora Freeman tuvo esa oportunidad de tener un mentor desde que estaba pequeña. So this is like you take it from me and I take it from you, and that's so beautiful, and that's what's happening right now. Because I gotta tell you, I'm so emotional right now because there's tons of people watching you guys that are, you too are their heroes. I gotta tell you these. Hay mucha gente ahorita pendiente de ustedes, que ustedes dos son sus héroes because you literally changed their lives. You have given them their lives back, literally. And we're going to find out later on what I'm talking about. They're here, they're shouting. But, okay. Le estoy diciendo a la doctora Lane Freeman que aquí hay mucha gente feliz y que agradecidos por ellos dos, que son sus héroes, que literalmente le devolvieron la vida. Y que yo quiero saber cuál es el secreto, cómo lo hacen. So I thought it'd be great to start talking on probably root canals. Yo pensé que tal vez era una buena idea empezar hablando sobre endodoncias, canales, root canals, tratamientos de conducto. How do you like it? How do you like it?
Well, we used to like it a lot until we became familiar with research that was published over 100 years ago. And the research stated way back then that root canals could not be trusted, that a root canal in a tooth remained infected. And so and since then, of course, we have lots of data now to show that it's impossible to sterilize a root canal tooth. You simply can't do it. And so, but in the process of doing the root canal, you remove the blood supply to the tooth. So now the tooth, you're unable to deliver the body's own immune defenses to the tooth. And so you have this little incubator full of bacteria and their toxins, which can, of course, disseminate and impact our systemic health. So we're not fond of root canals. We wish we could save a tooth by doing a root canal and without it being a toxic issue. But the truth of the matter is, you cannot sterilize a dead tooth.
El doctor Noldi me dice que ellos eran fan de root canals, de endodoncias y de tratamientos de conducto, solían hacerlas, pero después vieron la ciencia dura de que era imposible mantener limpio, sin infección, un órgano que está desconectado del cuerpo, un órgano que no tiene arteria, vena ni nervio y que está en la boca, se va a infectar por más de que lo limpies. Y esa es la verdad, y ya no es tan fanático de los tratamientos de conducto. But what do you have to say about people who say, these x-ray, I mean, they're perfect. These root canals look just wonderful, even in a cone beam. Pero ¿qué tienes que decir de esa persona que dice, en la imagen se ve perfecto este root canal, este tratamiento de conducto? No tiene ningún problema en la imagen, en el rayo X y en el cone beam.
Yeah. So I've seen many perfect root canals that have been done really well by a specialist. And the problem is not how well a root canal has been done. It really goes back to what Dr. Nunley was referencing before, in that once you remove the main trunk of the nerve and the main trunk of the blood supply, it's a dead tooth. It's a dead little mini organ, and now it's just sitting there. And we know in the medical community that nowhere else do we leave any kind of dead tissue. We know dead tissue is not compatible with health. And so that's the problem with a root canal tooth. No matter how well that filling material has been placed in the tooth, no matter how perfect it looks on the x-ray, you can't get around the fact that those teeth, when extracted and tested, always show some level of toxicity, some level of chronic infection.
La doctora Lane Freeman me está diciendo que no importa qué tan bien se vea en los rayos X, el tratamiento de conducto o en un cone beam, siempre está infectado. No importa lo bien que esté hecho técnicamente el tratamiento de conducto, puede estar perfecto y verse sin infección en la imagen, siempre está infectado. But there's some people thinking here, probably, I know, I'm pretty sure there are a lot of dentists here trying to defend their what they actually do, and of course they've been convinced they think positively for the patient, but is there hard rock science to back these up? I mean, have you guys done any kind of study where you actually have tested it? Hay mucha gente que aquí está viendo esto y diciendo, ¿hay acaso ciencia detrás de esto, de que todos los tratamientos de conducto están infectados? Vamos, esto es una cosa que se hace siempre y está bien hecha. ¿Hay acaso ciencia dura? ¿Esto está probado científicamente? ¿Ustedes lo han investigado?
Yes, there's hard data, and I've even put some of that data on our own website. We've condensed some of that data so that patients don't have to search the literature, but we know that there are many, many papers now that demonstrate that you cannot get a root canal system sterile and that it can pose a threat to other systemic health issues. I think in particular, well, it's interesting how there are even articles today that would suggest that root canals not only can cause autoimmune issues and rheumatic issues, but even issues, if you can imagine, psychological issues like depression. When you get these concentrations of bacteria and their toxins together, which are very well known now in the literature, they can produce a wide range of systemic health consequences.
El doctor Nonley me está respondiendo que sí, que hay data científica muy fuerte y que la tienen mostrada en su website, en su internet, en su página que más tarde vamos a mostrar, y que no solamente aumentan la probabilidad de enfermedades cardiovasculares o autoinmunes, también condiciones emocionales por culpa de las toxinas que se liberan de estos tratamientos de conducto. So does it mean that we're all at risk? I mean, we all do have, we all, maybe not you guys, but we do have root canals and I'm doing great. I mean, I don't feel emotional, as you just said, Doug, and I think I'm in good shape. Esto quiere decir que todos estamos en riesgo. Yo tengo tratamiento de conducto ahorita, doctor, pero yo me siento bien. Yo no tengo ninguna enfermedad que yo sepa.
So I have a lot of patients that say the same thing, and that's why you have to look at every person individually. So I definitely have some patients that have a root canal that on an x-ray looks good, doesn't appear to have a secondary infection or an abscess. And so we talk about that their particular immune system, it's not because the root canal doesn't have any infection, it's that their immune system at this time seems to be functioning and processing those toxins appropriately. It doesn't mean that it isn't a burden on their immune system, but their immune system just happens to be functioning well. And there are some patients who, I've got some 80-year-old patients that have root canals, don't appear to have any major medical issues. And then again, I'll have a patient who said they were fine and perfectly healthy and then had a root canal and their health immediately began to crash. So everybody is individual and we have to approach it like that. It's not a blanket diagnosis.
La doctora Freeman me está aclarando que, bueno, ella tiene, es una pregunta muy común. Ella tiene muchísimos pacientes que tienen tratamientos de conducto y siempre lo dicen, mira, yo me siento bien, y que cuando ella los analiza y los ve, dice, no, mira, aquí tienes un absceso y tu sistema inmunológico está peleando eso. Y hay veces que no hay ni absceso mayor, y hay gente que llega a 90 años con los tratamientos de conducto sin ningún problema. Es como cualquier otra cosa. O sea, hay gente que sí, hay gente que no. Pretty much like the cigarette, right? People who smoke, they reach 90s in perfectly healthy state. But we're not going to say it's healthy to smoke, right? I agree with that. Yo le estoy diciendo, bueno, igual que hay gente que fuma, que llega a los 90 años, pero no vamos a decir que fumar es cigarrillo es sano. But what's the data on cardiovascular risk with root canals? ¿Cuál es la información con el riesgo a infarto cardiovascular con los tratamientos de conducto? ¿Cuál es la relación que puede haber?
Well, you're certainly at much higher risk of cardiovascular event or also of cerebrovascular event of stroke if you have a root canal treated tooth. But there was an interesting study done just 2 years ago that showed that if a root canal treated tooth had an abscess that you could see on it on a cone beam or a regular x-ray, that the patient had if this is interesting, it's hard to believe this, but they had a 560% increased risk of a cardiovascular event than if they did not. And when you look at root canals worldwide, there have been 17 studies to determine how often root canal treated teeth develop these infections. And 40% of the root canal treated teeth worldwide develop these infections that predispose the patient to this incredible risk of a cardiovascular event.
I'm not feeling that well right now with all that knowledge. El doctor Nolly me acaba de decir que uno tiene 500% más probabilidades de un evento cardiovascular, un infarto, un accidente cerebrovascular isquémico con tener un tratamiento de conducto, que en la imagen se ve el absceso. En la imagen puedes ver, en la rayos X, puedes ver que tiene un absceso. Esas personas, que son el 40% de un estudio de 17 que se hicieron en el mundo entero, tienen 500% más probabilidades de tener un infarto. You know, Doc, I'm thinking cholesterol, high blood pressure, take this pill, exercise, meditate, veggies, but that wasn't in my radar. Pero yo estoy pensando, doctor, de comer sano, vegetales, hacer ejercicio, por eso no estaba en mi radar. And truth of the matter is that I lost my dad when he was 54 at a heart attack. His first symptom was death. Yo perdí a mi papá cuando tenía 54 años. Su primer síntoma fue la muerte. And I'm thinking about him, and his mouth full of root canals. Y yo estoy pensando en él, y tenía su boca llena de tratamientos de conducto. And I do have one. And if I had known this information, y si yo hubiera tenido esta información, when they were going to get me that root canal, cuando me iban a hacer ese root canal, I would say, no, I don't want the root canal done on me. Is that fair to say that in the future, we should be having formal consent, like, hey, you should know this. Don't you think? Is that fair to say?
Yes, absolutely. I'm sorry, didn't mean to interrupt you. I think that's important. If there are some other dentists watching, it's never a judgment on a dentist if they're trying to take care of their patient. But it is important to have all the information. And so anytime we have a patient come in and either they already have a root canal or maybe they have a tooth that has an infection and it's hasn't had a root canal before, we're going to give them all of their options because the patient needs to be informed of the risks and benefits on both sides because it's either have a root canal or have the tooth extracted. Both of those are irreversible treatments. You can't undo a root canal and you can't undo taking a tooth out. So it is so important to give patients all the information, and especially with extractions, we have to give the patients, it's very accepted that we give them lots of information about extractions. But with root canals, that's never been the standard to tell them, you know, you can have a root canal, but here are the potential hazards and here's what a root canal really is. And so just like you said, informed consent is really important because not many patients, after you tell them all that potential hazards with a root canal, decide to have one.
Yo le estoy diciendo al doctor Nolly y a la doctora Freeman que yo no me siento tan cómodo con esta información. 500% más infarto. Mi papá murió de infarto cuando tenía 54 años. Su primer síntoma fue la muerte. Y a mí me hicieron años después un root canal, una endodoncia, un tratamiento de conducto. Si yo hubiera sabido esta información, yo hubiera dicho, yo no quiero el tratamiento de conducto. Y les estoy preguntando, ¿no ven que en el futuro sea necesario implementar consentimiento informado, que le deben de decir al paciente, mira, te podemos hacer el tratamiento de conducto, we can do the root canal to you, pero these are the risks, pero estos son los riesgos. Do you accept it? Y la otra opción es que te saquemos la muela. ¿Qué quieres? ¿Salvar el diente muerto? What do you want? Save the dead tooth? Or you wanna have an extraction? Porque hay veces, it seems to me that we're saving the tooth, we're killing the patient. Meaning, for those people that really die, I mean, of course, it's not everyone that's going to die, but for those people, it's 100%, right? For me, if it's me, it's 100%. Porque parece que estamos salvando la muela, pero estamos matando al paciente. Digo, no todo el mundo se va a morir, pero para la persona que sí le va a ocurrir 500% más infarto y se va a morir, al verle salvado la muela, implicó la muerte, perdido la vida. So, it's very important to clarify that, and I thank you for that. Very important. So, how do we know if we have a cavitation? What is that in first place? What is a cavitation? Les estoy preguntando cómo sabemos si tenemos una cavitación. Estoy cambiando el tema. ¿Qué es una cavitación? And before we get into that, I just want to tell a small story here. Antes de empezar en esto, quiero contar una pequeña historia. Yo no sabía qué era una cavitación. Back then, I never knew what a cavitation was. Y yo me encontré con la información de Dr. Nunley. Y yo me encontré, I came across with Dr. Nunley's work. And so I have this patient with trigeminal neuralgia. Y tengo este paciente que me está consultando por neuralgia del trigémino. First time with his knowledge. Por primera vez con el conocimiento from Dr. Nunley. And so I knew what a cavitation was. I just had known, I learned that from him. Y en ese momento acababa de aprender qué era una cavitación. So I say, well, you know, you need a cone beam. Y le digo, tú necesitas un cone beam. Seguro tienes una cavitación que está produciendo tu neuralgia del trigémino. I'm pretty sure you got a cavitation that it's making that pain happen. And so, sure enough, this lady gets a cone beam. Y rápidamente esta paciente se hace un cone beam. And so I say, well, I don't know anything about this, but you probably have it, I'm pretty sure. Yo no sé nada de esto, pero go find your dentist and tell him. Busca a tu dentista y dile. And so she goes to her dentist, y ella va a su dentista y le enseña el cone beam. And she'd been to many dentists, right? And she had the worst mouth ever. But the dentist says, you got a perfect mouth. I mean, there's nothing wrong here. Y el odontólogo le dice, ahí no hay nada. Tu cone beam está perfecta. Ahí no hay nada. And I'm calling my cousin, who's a dentist, happened to be a dentist overseas, and I'm calling everyone asking. And to my surprise, nobody knew about this. Everyone is saying the exact same thing. There's nothing there. It's perfect. And I'm like, oh my God. And I knew it from Dr. Nunley that they don't know about it. I couldn't understand that. How come? Y yo lo sabía por el Dr. Nunley. No lo enseñan, no lo saben, no lo diagnostican. Y yo decía, ¿cómo es posible? So, short story, but please tell us, what is a cavitation, Dr. Freeman Nunley?
Well, a cavitation is a stagnant area in the jawbone. The jawbone has a poor blood supply to start with, and the jawbone can develop in these stagnant areas. They can develop an area where the blood slows to the point where bacteria can thrive. It usually happens where a tooth has been removed. And for example, if the tooth is removed and the bacteria from the mouth go into that hole, we may grow a little gum tissue over it and a little bit of bone, but we're left with an infection in the jawbone. And the jawbone is only one bone in the body that forms cavitations. There are, for example, the hip is a common area to develop a cavitation from trauma, and other bones as well that don't have a good blood supply. But the jawbones, the upper and the lower jawbone, are the most common. So it's a hole in the jawbone filled with bacteria and their toxins, and that's what can have an impact on our systemic health.
Yo le estoy preguntando al doctor Noldi qué es una cavitación. Y él me dice, es un pequeño agujero, hueco, en el hueso de la mandíbula, que también puede estar en otros huesos, frecuentemente también ocurre en la pelvis, y que se llena de bacterias que no respiran oxígeno, bacterias anaerobias, que producen las toxinas más peligrosas que pueden existir. Y generalmente ocurre ese hueco en el sitio donde hubo una extracción, en el sitio donde hubo un trauma o inclusive donde hay un tratamiento de conducto. Puede ser que termine infectado y produciendo una cavitación. So taking it from that, I believe it should be very painful then. I mean, people with that hole in their jaw should be all the time. Le estoy preguntando, entonces ese hueco en la mandíbula debe ser muy doloroso. La gente debe estar gritando del dolor.
So, no, that's very common for them to not have any pain. Just like with root canals, you can have a root canal that has an infection that produces no pain. So, just like with heart disease, just because something doesn't hurt doesn't mean that it's not a big problem. So it's very common for cavitations and root canals to not have any pain. And I know that doesn't make a lot of sense. Patients have that same question, but they rarely cause pain with a cavitation, although there are, as you mentioned earlier, cavitations that are associated with trigeminal neuralgia, and those do cause pain.
La doctora Lane Freeman me está diciendo, no, las cavitaciones no necesariamente producen dolor. La gente está caminando con cavitaciones y no lo sabe, no tiene dolor, tiene bacterias que orinan y defecan toxinas muy graves y no lo saben, no tienen dolor. Algunas producen dolor, algunas que producen dolor causan neuralgia del trigémino, pero las mayorías no producen dolor. So, how do we know we have one of those? Entonces, ¿cómo sabemos si tenemos una cavitación?
You know, if you've had a wisdom tooth removed, you have a pretty good chance of having a cavitation. I think the gold standard now for seeing these is to have a cone beam analysis. And, you know, there are great radiologists around the world, especially Dr. Itriago, who can really see these very, very well. And they help us to be able to visualize these. I think that is by far the gold standard. But the most researched man in the world on this is a gentleman in the United States named Dr. Bucco. And Dr. Bucco has stated before that somewhere around 40%, I think it's probably even higher, of extraction sites, especially in the posterior part of the mouth, will end up in cavitations.
So what you're saying is that it's so common that 40% of people have extracted their wisdom tooth, teeth, have cavitations?
Absolutely.
El doctor Noldi me cuenta que si te quitaron las muelas de juicio, los terceros molares, tienes altísima probabilidad de tener cavitaciones allí. Y prácticamente el 40% de la gente que le han quitado las muelas, 40%, 4 de 10 personas tienen ahí cavitaciones, bacterias que producen toxinas de las más peligrosas. What does it happen? I mean, should we tell our dentist, hey, please extract my tooth, but don't give me a cavitation. Should we ask for it? I don't understand this. Why? Yo le estoy preguntando al doctor, ¿por qué ocurre la cavitación donde te extraen una muela? Le deberíamos pedir a nuestro odontólogo, por favor, sácame la muela, pero no me regales una cavitación.
So the way that we avoid having a cavitation develop after an extraction, whether it be from a wisdom tooth or from a root canal tooth that we might be removing, once we take the tooth out, we have to go back in and really clean out the socket, the bony socket where the tooth was. So if it's a wisdom tooth, it might have a little ligament, which is a little soft tissue around it, or it might have the whole developmental sac around it. And when you take a tooth out, either a wisdom tooth or another tooth, you kind of shred that tissue. So you have to go in there and clean that out and also make sure that you remove any infected tissue around, say, a root canal. And then when you do that, you're making sure that the blood flow is really good there. Now, in addition to that, we have some other protocols that we can use. All of these things are meant to encourage and enhance the healing so the body can heal that area without trapping bacteria in there. And the key to that is keeping good blood flow there. So using ozone in those areas and also using PRF, which is platelet-rich fibrin in those sites as well. That's how we avoid a cavitation after an extraction.
La doctora Freeman me dice que tienes que extraer bien el ligamento periodontal y llegar a hueso sano y dejar que sangre y llegar, quitar todas esas bacterias y limpiar bien. But I think that everyone does it, right? I mean, isn't it the safe standard protocol? Doesn't everybody do it? Yo le estoy diciendo, bueno, pero no todo el mundo hace eso, no es de cajón. ¿Acaso que tienes que limpiar, quitar el ligamento? Es el protocolo, no todo el mundo lo hace.
That's a good question, but you know, unfortunately, not everyone does, including me in the early part of my career. I really didn't know to clean these sites out vigorously, and certainly back then we didn't have platelets, concentrated platelets that we can take from the patient. We can draw a little bit of their blood, spin that down in a centrifuge, and then put those into the surgical site, the extraction site. And we get such a wonderful healing response from that. But we, to tell you the truth, in our traditional training, we're certainly not taught to do that procedure.
Bueno, esto me impresiona la respuesta del doctor Nunley. Yo le estoy diciendo, ¿acaso no es el procedimiento estándar? Y me dice, no. Hace mucho tiempo no contábamos con el plasma rico en fibrina que estamos usando ahorita con excelentes resultados. De hecho, el doctor Nunley está diciendo, yo mismo no sabía hacerlo bien al principio. La limpieza, quitar todo el ligamento periodontal. Y la verdad es que no nos enseñan a hacer este procedimiento. Y yo me impresiono porque me está hablando de una lesión que se llama cavitación, que yo he visto que cuando la curan, mi paciente from wheelchair stands up, desde la silla de ruedas se para, with pain in their fingers is gone, con dolor en sus dedos se le quita. Yo he visto como mi paciente con Hashimoto's, después de hacer esa limpieza, los anticuerpos se negativizan y ya no tiene que usar tiroides. They throw thyroid medicine away after that procedure. I've seen that, so I'm like impressed. I'm like, how come? It should be first order. I mean, come on. You're telling me nobody knows how to do it perfectly? Isn't it a daily routine everybody knows how to do? He says, no todo el mundo sabe hacer esto. Nos contamos con esta tecnología. And what is it about this epinephrine thing that I hear about so often? ¿Y de qué trata esto de la epinefrina en la anestesia que yo oigo a cada rato?
So epinephrine is found in a lot of our anesthetics, what we use to numb a patient. But epinephrine itself is a vasoconstrictor, so it restricts the blood flow to an area. And that's in there usually because it helps the anesthetic last longer. But what that does when it restricts that blood flow is it does the exact opposite of what we're trying to do, which is encourage blood flow to the area. So we avoid using epinephrine around these surgical sites so that we don't inhibit that blood flow in any way.
Yo le estoy preguntando a la doctora de qué trata esto de la epinefrina en la anestesia y me dice la epinefrina es un vasoconstrictor y a los odontólogos les encanta la epinefrina porque así no sangra la herida y es limpia la cirugía y todo es perfecto, pero al ser vasoconstrictor no llega la sangre, al no llegar a la sangre el hueso no respira y al hueso no respirar el hueso se muere. It's a dead bone, doesn't breathe. Are you gonna cement esa bacteria ahí de por vida? You don't want to do that. Hello, wake up and smell the coffee. No puedes matar el hueso. Oh my God, I can't believe all this. Because as you just said, not everyone does that, right? I find this unbelievable, and the reason why is, yo encuentro esto increíble y la razón es, he visto como pacientes míos, después de haber estado con ustedes, con hipotiroidismo de Hashimoto, anticuerpos altísimos, ustedes hacen esa limpieza de la cavitación, quitan ese root canal y los anticuerpos se negativizan. Inclusive el paciente ya no requiere muchos de ellos la tiroides. Not all of them, but some of them, they don't require. I've seen it. I mean, it's not that I read it on the internet, not that somebody told me, it's not that I think, it's that I've seen it, and they're here tonight. Again, with rheumatoid arthritis and lupus and all these things. So before we move on, I'd just like you guys to tell me spectacular testimonials that you have in your... I know everyone doesn't do that well. It's just a part of the puzzle. Yo les estoy pidiendo que por favor me den testimonios que ellos han vivido. I mean, we have many here. They're here gathered. But there are many people that don't even know me. They're here because I have been invited tonight to listen to you two. Hay muchos aquí que me conocen y están viendo esta charla, pero muchos no me conocen. Han sido invitados by your testimonials. They're here because your testimonials brought them here. And they want them to listen to you guys. And I just... Y yo quería que ustedes nos regalen unos testimonios de lo que han visto en autoimmunity, en enfermedades autoinmunes, en neuralgia del trigémino, Alzheimer, even Alzheimer's. I mean, I've had patients that their memories, their fatigue, their lumbar pain, their, you name it. Yo quiero que ustedes nos regalen testimonios. And I just want to make something clear before we move on. Y quiero dejar claro, this is not the silver bullet for everyone. Esta no es lo que te va a curar a todo el mundo, but it's happened to some. Pero sí para algunos. Aunque no todo el mundo con quitarle un tratamiento de conducto o curarle una cavitación se le va a curar el lupus, se le va a curar la artritis. I'm not saying that. No estoy diciendo eso, but I've seen it happen. All I'm saying is I've seen it happen. For some people, it's 90% of the puzzle. Para algunos, some of my patients, they did everything. I mean, God healing, nutrition, yoga, loving your parents, forgiving them for everything, veggies and juices and carrots and magnesium and all that. And still 10%. How's your pain? Oh, doc, I'm like, oh my God. And then after Dr. Nalene Freeman, they're like, woo! Dancing on the floor. They're back on the street. I'm like, oh my goodness. People gotta know this. Y quiero dejar claro, antes de empezar esto no es que tú te vas a quitar un tratamiento de conducto, te vas a curar una cavitación y ya se te va a curar el lupus o la miastenia gravis o el Sjögren o la psoriasis. No estoy diciendo eso. Estoy diciendo que yo he visto que en algunos de mis pacientes ha representado la sanación del 90% de sus síntomas. Muchos han dejado las medicinas, muchos en silla de ruedas se han parado, muchos ya no requieren ni siquiera medicamentos. Ha representado el 90%, en otros es el 10%. Es un asalto más y le estoy pidiendo al doctor Nunley Freeman que me regalen los testimonios. Okay, please.
Well, you see, people would not have a problem at all expecting some sort of a miraculous recovery if they had a wound on their arm or they had a large wound on their leg. And then if that wound were eliminated, they would expect that they might have some kind of marvelous recovery. The truth of the matter is somehow we've overlooked these wounds in the mouth And those oftentimes have a toxicity that would rival any other kind of wound, even a gangrenous wound. And so when we eliminate that sort of toxicity, we oftentimes do see some really quite miraculous recoveries. It's not everyone, as you said, is going to have that kind of recovery, because we never know whether it's 10% of the puzzle or 90% of the puzzle. But oftentimes, I would say most times, it is a part of the puzzle. And it does give people the opportunity, it gives their immune system the opportunity to respond.
And please give us some examples. El doctor Nolly me dice, es verdad, nunca sabemos quién va a ser el 10% o el 90%, quién va a tener una respuesta milagrosa, quién se va a curar de su enfermedad. La gente tiene grandes expectativas. Ciertamente, quitar un tejido necrótico en el cuerpo es quitarle un impuesto al cuerpo, al sistema inmunológico, y es mejorarlo en todo escenario. Pero nunca sabemos cuánto representa esa infección en todo su tema de la salud. Puede tener toxicidad por metales pesados, puede tener intestino permeable, puede tener parásitos, puede tener, I mean, you name it, everything. And this could be just a small part of the puzzle or a big part of the puzzle. Y esto puede ser algo pequeño o algo grande. We never know. Pero ciertamente, but certainly hemos tenido spectacular testimonials, some of them. And I'm asking him, y le estoy pidiendo que por favor me cuente testimonios espectaculares. And I'm asking him to give me spectacular testimonials.
Well, so, some of the most spectacular are patients who have rheumatoid-like symptoms, or who have blatant rheumatoid. And it seems to me like dentistry and the infections of dentistry can have some of the greatest impacts on patients who have these rheumatic-type diseases. So lupus and rheumatoid are ones that respond very often. And we have seen patients who were wheelchair bound who are now doing fine. For the most part, their diseased tooth was one of the primary causes of their systemic illness. So we've seen that. We've certainly seen patients with Hashimoto's just within days, as almost a miraculous recovery. It's because those toxins love to go to the thyroid. We've seen, of course, patients who had seizures recover just by getting the mercury fillings out of their teeth. We've seen patients who have everything from vertigo to depression, have those sorts of things just go away within a matter of days to weeks after having their dentistry cleaned up. So it's we could really sit here for the rest of the night and talk about one recovery after another. We don't want to be braggadocious about that, because we certainly have patients who don't completely recover, and it's very disappointing to us. But oftentimes dentistry has a big impact on their systemic health.
Dr. Lane.
Yeah, just to piggyback on that, I think we've both stopped saying there's no way that could be related, because we've seen some symptoms. Maybe a patient has a whole myriad of symptoms that don't have a diagnosis, maybe random pains in a neck or a shoulder or in a leg, and those completely resolve. And they didn't have a specific diagnosis because they'd been passed from doctor to doctor that thought they were crazy. And we've seen those changes happen, and we've been blessed to be a part of helping those patients do that. So there are many stories that we could sit here and talk about.
El doctor Nolly me cuenta que ciertamente ha visto revertir Hashimoto, enfermedades autoinmunes, sobre todo artritis y lupus. Prácticamente es una enfermedad de la boca, podría decir él. Ha visto gente sentada en la silla de ruedas ponerse de pie después de años de tratamiento, años con artritis. Ha visto gente con vértigo corregir, gente con arritmias, gente con depresión que literalmente se va en días o semanas, gente que sufría de depresión por muchísimo tiempo y que, bueno, que él no quiere, I don't know how to say bragging in Spanish, él no quiere eso, apantallarse, dice el venezolano, pero porque nunca se sabe quién se va a sanar. Ciertamente no todo el mundo se sana. Algunas personas, bueno, le produce una desilusión ver que no mejoran del todo. Nunca se sabe, pero ciertamente es quitar un impuesto. Y la doctora Lane Freeman agrega, dice, es un honor poder ver a la gente sanar en una cantidad de síntomas que sus médicos no sabían relacionar. No tenían un diagnóstico definitivo, pero tenían todos estos síntomas y estaban sufriendo, y verlos recuperar, estar con ellos, es una maravilla. Before we move on, I'd like to get your take on why is it that there's so much resistance in the dentistry and medical field about these cavitations, about these root canals. I mean, after the evidence, you take out, you clean them out, and this happens. You don't need any other evidence. I mean, it's there. Why is it that there's so much resistance? Yo le estoy preguntando por qué hay tanta resistencia en el mundo odontológico y médico. No se necesita más explicación, ahí está la evidencia. Los pacientes mejoran, se curan. ¿Por qué no se reconoce esto?
Well, there's probably a lot of different reasons. I choose to think that most dentists really want the very best for their patients, and especially when it comes to root canals. You know, for a long time we were taught that to remove a tooth would just be barbaric, and so we had to find any way to save that tooth. And I think a lot of dentists feel that way. But once you see the research and you see the toxins and the toxicities of these teeth and the potential problems they can cause, you can't unsee that. And a lot of dentists just haven't been exposed to that research because you have to go look for that. It isn't taught in a conventional dental setting. We don't hear about that at a conventional dental meeting. You have to seek out that information. And so I think a lot of it is just that it's just not available to as many dentists as it should be. A lot of patients who present a lot of this information to their dentist. They've done the research and show it to their dentist. And so I think that's part of it, is that the information is just not out there. Do you have anything to add?
I think it also, too, it goes unrecognized because some patients do very well with traditional dentistry. And so we make the assumption that everyone is going to do well. Or if they have some sort of systemic health issue, we never look to see, could it have been caused by something in the mouth?
Wow. Wow. La doctora Lane Freeman me dice que, bueno, que la mayoría de los odontólogos quieren lo mejor para sus pacientes y están conscientes de que están haciendo el bien, pero la verdad es que nunca han sido expuestos a esta información. En realidad, uno crece como odontólogo con la mentalidad de que antes éramos unos bárbaros quitando muelas por quitarlas y que lo que uno hace bien es preservar la muela. Pero cuando te das cuenta de la toxicidad, de las infecciones, y la verdad verdadera es que esta información no se nos enseña, y solo cuando uno la ve y la estudia y la aprende es que hace el cambio. Y bueno, la verdad sea dicha, la mayoría de los odontólogos tienen que ser muchas veces educados por los pacientes, quienes son los que le llevan esta información y le dicen, mira, hay toxinas aquí, yo no quiero ese tratamiento de conducto, y así ocurre. Y después el doctor Nunley agrega que también tiene mucho que ver con que estos procedimientos, extracciones, root canals, tratamientos de conducto, en mucha gente van bien, en mucha gente no producen enfermedad, en mucha gente sigue su vida perfecto. Y entonces el odontólogo no hace la relación de que el tratamiento de verdad está produciendo un asalto a la salud. Y me parece bien importante esa aclaratoria. There's no been a single patient of mine that been to your office. No ha habido un solo paciente mío que haya ido a su oficina that hasn't called me right after, I mean, the very same day they're out of the office, que no me ha llamado exactamente el mismo día que se van de ustedes, que se van de la oficina, which is I believe the third day, que creo que es el tercer día, from the car, desde el carro. I mean, I'm not exaggerating, y no estoy exagerando. I'm not making this up. From the car, they called me to thank me. Desde el carro me llaman a darme las gracias. They say it is one of the most, or the most at times. Dicen, ha sido una de las más, o la más beautiful experiences I've ever had. Experiencias más bellas que yo he tenido. The first time I heard that, I'm thinking, going to the dentist, the most beautiful experience in your life. La primera vez que yo escuché eso, yo dije, ir al dentista, la experiencia más bella de tu vida. And so they start talking to me, they can hold their breath, empiezan a contarme, se les va el aire, telling me how you guys prayed before the surgery for them, and how lovely Mrs. and Mr. were opening the door and hugging them and all the lovely things, and how they touched them, cared for them, and took them for dinner. And I'm like, oh my God. Y me cuentan cómo los consintieron, los sentaron, los tocaron, rezaron por ellos antes de la cirugía. And I'm like, Ludwig, you should do that with your patient. Maybe in the next appointment, you should just say, I just want to bring up the spiritual connection here. Quiero sacar a la luz la conexión espiritual aquí. What are your beliefs in terms of spirituality? ¿Cuáles son tus creencias desde el punto de vista espiritual? Dr. Nunley.
Well, we're a Christian organization. We see people of every imaginable faith every week, and that's a privilege for us. We love to treat people of all faiths, but we are very much a Christian organization, and as such, we are dependent on God for our discernment and for our knowledge, and and more than anything, and in fact, I think this is as important as the therapies that we offer and the surgeries that we can do, is that we want to help love these patients through these experiences, and we want to stand by them and walk side by side with them. And that's a very unusual thing in medicine and dentistry today. It's the whole, I think it's just that we want to invest in our patients in an incredible way. And we want their experience to be not what they would expect in a medical or a dental office. We want it to be the greatest experience they've ever had.
And you do so. You truly connect, and you become memorable and forever a hero for them. And it's just beautiful, and it shows. I just want to let you know. El doctor Nunley me cuenta que él pertenece a una asociación cristiana, y en realidad él acepta religiones de todas partes y trata a todo el mundo de todas las religiones y todas las creencias, pero ciertamente está en ese sentido conectado y quiere ser una experiencia muy especial para las personas fuera del mundo médico, quiere relacionarse en otro nivel. Dr. Freeman, do you have anything to add in terms of that?
Well, yeah, I echo everything Dr. Nunley said, but just to add, we really want the Lord to bless everything that we do. We feel very privileged that He allows us to take care of every single person that walks through that door. We don't think it's an accident that anyone comes to see us. And so that's a great privilege and an honor. And we just want each patient to feel loved and safe while they're here. And that doesn't usually happen at dental offices. Most patients haven't had an experience like that. We want them to kind of forget that they're at the dentist. if at all possible. But that's really what I would add to that.
La doctora
Is
dice
a
que
blessing.
ella se siente honrada, que puede ser parte de la vida de las personas y atenderlas y ciertamente es una bendición poderlas atender. I couldn't forgive myself that I don't read the list that I have here. This has been back and forth. I'm gonna just move fast and all the time is gone. But I just want to talk a little bit about vitamin C. What is it about vitamin C? What's the problem we don't use it? You do it before and after. I think it's a 3-day trip. First day you get vitamin C. Third day you get vitamin C. There's a lot of dentists out there that are not using vitamin C. They haven't been training it. Some of my dentists, the ones that are following me, are now trying to mimic your protocol with great results, some of them. And they're using vitamin C. They just don't believe it. What they're seeing. Oh my God, unbelievable. They have anesthesiologists next to them saying, "Oh, I'm not leaving you. This is harmful. 25 grams. Oh no. I gotta see this. Maybe something's gonna happen. I'd rather be here." ¿Qué es este tema de la vitamina C intravenosa antes y después de la cirugía? Ustedes lo hacen el primer día, el tercer día. ¿Por qué la usan?
Well, vitamin C is a fabulous detoxifier, and we are dealing with some very, very potent toxins. And vitamin C by itself is not a great chelator of the toxins, but it helps amp up our glutathione, which God put in every cell in us. And then, of course, the glutathione can do its work when we have vitamin C levels up high. So we love to have it on board. And of course, there's study after study, thousands of studies on the efficacy of vitamin C, and especially as it relates to wound healing. We see wounds heal in a much shorter time than if we were not using vitamin C.
El doctor Naldi me está contando que con vitamina C ven una recuperación rapidísima, no es un gran quelador, pero ciertamente estimula la molécula que limpia de toxinas al cuerpo, que se llama glutathione, y con esa ven recuperaciones violentas. And what would be the problem, not only in recuperation terms, ¿cuál sería el problema of not using vitamin C? Is there any risk of heart attacks or cardiovascular risk, like let's say 3 weeks after a dental intervention if you don't use vitamin C or you're protected with it? Le estoy preguntando si hay un problema si no se usa vitamina C. ¿Hay acaso algún riesgo incrementado de algún infarto o accidente cerebrovascular isquémico si no se usa vitamina C?
No, not with vitamin C. There have been, again, thousands. There's probably not a more researched supplement.
No, I'm sorry. I didn't explain myself. I meant if I've heard that there are studies that have proven that the bacteremia that you get out of a dental procedure raises your cardiovascular risk for I don't know how many weeks after that. And it just, you know, a thought occurred to me that maybe using vitamin C would prevent that from happening. What's your take on that?
Yeah, I would definitely have to think it would improve a patient because we know it's going to help them detoxify quicker, more safely. The wound's going to heal more quickly. I know of no, I know there are very, very few published studies that have shown that vitamin C wasn't a help. The preponderance of the studies by far suggests that vitamin C is a tremendous help in detoxification and wound healing.
Yeah.
So,
Yeah. La mayoría de mis pacientes, they show me pictures. La mayoría de mis pacientes cuando salen de ustedes me enseñan fotos de su cara y me dicen, mira, no estoy nada inflamada y en comparación cuando me sacaron esta pequeña muela y todo lo que me han hecho, mira cómo me puse. En cambio, con Dr. Naldi Freeman no me inflamé. Yeah, many patients of yours that just, they send me picture of their faces right after their procedures with you guys. And they say, look at me, I look normal, unbelievable. I had an extraction back then 10 years ago. I looked like, you know, this big, and right now I'm doing so well. I know why. Probably is all the whole thing, acupressure and all the things that you do. Dr. Freeman, what about ozone? I mean, there's a lot of practitioners out there that are not using vitamin C, but still they're not using ozone. What is it? What is it for? Hay mucha gente que ¿Qué me puedes decir sobre el ozono? Hay muchos odontólogos que no están usando el ozono. ¿Por qué ustedes usan ozono?
So ozone is a really important part of our protocol across the board in the way we do things in our office because it has so many different uses. So one of the most important uses would be that it is very antibacterial, antiviral, and antifungal. And so we can use it in a lot of areas that are infected either in the tissue but also in the bone. And we can use it to sterilize a tooth that maybe we're going to put a filling in. But when we use it in association with our surgical procedures, after we remove a tooth or clean out a cavitation, we're also using that to decrease inflammation and increase blood flow. So it's just such a great tool with so many uses, and it's very safe when used properly.
El ozono lo usamos para desinfectar. I'm sorry. Yes, sir.
No, and I love the fact that that Lane mentioned it increases blood flow because we struggle in the jawbone with this lack of blood flow, but ozone opens up the vascular beds and we can see it immediately. We can inject ozone into an area, we can see that area begin to bleed robustly, which is what we need for an adequate healing.
Maybe that's the reason why there's so many relapses or cavitation. You know, I've had patients that they're in Europe or they're in Asia and they're like, what's my option? And they go to these biological dentists, they're very good, and they do these procedures. They're not using vitamin C, or they're using like 5 grams of vitamin C. They're not using ozone, but they're biological and they know how to do it and they're great and all this. And after 6 or 10 months, they have a cone being redone with Dr. Triago again, and they still have and no symptoms go away. And so they call back to, I still have the same issue here. I mean, it's the same image. Dr. Triago says I still have my cavitation. They don't know what to say. They don't know how to answer. I'd like to have your comment on that. Are relapses common on cavitations? Le estoy preguntando porque yo le estoy preguntando por ozono y vitamina C y me dicen, el ozono es excelente para quitar, el ozono es excelente para quitar hongos, para quitar bacterias, y además, dice el doctor Noldi, aumenta la sangre en el sitio donde no hay buena vascularización. Y sangre es vida, sangre es oxígeno, sangre es preservar el hueso nuevo. Y eso nos encanta, que aumente la irrigación sanguínea en un hueso como el de la mandíbula, que no tiene buena irrigación. Y por eso el ozono también es muy bueno, además de que es fungicida, bactericida, virucida, antiinflamatorio, aumenta el riego sanguíneo, lleva oxígeno y entonces mejora la sanación. Y le estoy diciendo, es esta la razón por la cual curan las cavitaciones otros odontólogos y vuelve el problema, vuelve a aparecer la cavitación. What's your take on that, Doc?
Well, first of all, there are 12 studies to determine how often these cavitations reoccur. And in those 12 studies, 40% of the cavitations reoccurred after they were surgically treated. And so for years, before we used platelets and before we used ozone, and you know, we probably had we had a significant number of these fail. I don't think we ever approached 40%, but we may have had 10% that didn't heal. But we think now, using the protocols that we're using, that we are way under 5% of these that don't heal, and most of those I think are in patients that have really some systemic health issues that are very, you know, that are just make it difficult for them to heal no matter what we do. So I feel very good about the treatments that we're able to do now without running the risk of it not healing. I think for the most part they heal very, very well.
El doctor Noldi me cuenta que en la literatura hay más de 12 estudios científicos que dicen que el 40% de las cavitaciones vuelven a ocurrir. y en sus manos eso no es así. Menos del 5% vuelve a ocurrir cuando él ha llegado a formar un protocolo con su experiencia que es menos del 5%, mucho, mucho por debajo del 5%. Probablemente quiere decir un 1% cuando se usa ozono, vitamina C, plasma rico en fibrinas, no se usa epinephrine en la anestesia, cuando se hace todo el protocolo bien, no necesariamente. The reason I'm bringing this up is because maybe they're thinking my dentist can do this right away. Is it easy for a dentist that is not being confronted with this information, listening from you guys right now, to go out tomorrow and do it right away? Or does it take training, a little bit of... Yo le estoy diciendo, hay mucha gente oyendo y va a decir, mañana voy a ir a mi dentista que me quite mi cavitación. Because a lot of people are thinking, I'm going to go out tomorrow and get this cavitation right away, you know? ¿Es fácil que mi dentista me la quite? Le estoy preguntando.
So it definitely requires some training on a few different levels. First of all, when we have a cone beam that has a report from Dr. Itriago, that is beyond helpful. But many of our patients don't have that cone beam report from him, and so we have to read the cone beam ourselves, and we've been doing that for years, and are very comfortable looking at a cone beam and identifying areas that appear to have cavitation. So that's one level of training that's required. And then just the technique of training, of getting into those sites, knowing exactly where to go and how to approach those and how to clean them out and how to know that you've got it cleaned out does require some training. So it's definitely not something that's a simple process, and not just anybody would want to jump on doing it, but you can be trained to do all of those things.
La doctora Freeman dice que, sir?
Yeah, no question. The training, this is not rocket science surgery. It's a surgery that people can easily be trained to do. But you wouldn't want to be having this sort of treatment done if the dentist hadn't had adequate training.
Sí, me están diciendo que se requiere un entrenamiento especial, que no es algo que tú mañana puedes decir, ok, yo te lo hago, porque ciertamente tienes que saber cómo entrar, cómo limpiar, tener un entrenamiento. El doctor Nunley dice, bueno, ciertamente esto no es algo dificilísimo de hacer, pero se requiere entrenamiento para poderlo lograr. So that's very important. Implants. What about implants, Dr. Lane Freeman? Implantes, le estoy preguntando, mucha gente, there's a lot of people out there with implants. Some people are thinking about implants, getting an implant. Should they get metal? Should they get, I don't know, whatever there is. What's the problem with implants? Doctora, ¿qué me puedes decir de los implantes? ¿Metales, no metales? ¿Son malos? ¿Cuáles sí, cuáles no?
So implants as a concept are a very good idea. You can replace a tooth, and it's with a non-living inert material. The problem with implants, though, is that we only have two choices. We have traditional titanium implants, which would be metal, and then we have the newer, more biocompatible zirconia implants. Now, zirconia implants is like a ceramic. It's non-metal, but they're shaped the same. The procedure to place them is virtually the same, but the problem with the metals is that you've implanted a metal in the bone, and that metal can leach out. It's not just pure titanium, but then you also have zirconia, and while that is more biocompatible, I always tell patients, once again, it's a very individual decision to make as far as if you want to get an implant or not, because it's still something foreign that's being placed into the bone, and the body is going to respond to either one of those types of implants in some way. And as you mentioned, I have lots of patients that have both types of implants, and many of those patients do just fine, even with a titanium implant. But like we said earlier, you never know what the immune system's response is going to be to those things. So if I have a patient who has the option to choose, I'm going to always tell them to choose a zirconia implant because those are more biocompatible.
Give us the worst case scenario. Man, what would happen in the worst case scenario with zirconia or titanium? You call it leaching, but what does that mean in terms of things?
So worst case scenario would be that the body would respond not favorably to that implant, and that it might reject it. So you would lose the implant would be one thing. But sometimes the bone continues to heal around those implants, so the implant itself looks good, but the immune system has a crash or a response to that, and it may not have any pain, just like we've talked about, it might not have any pain or any symptoms that are locally around the implant, but the body's still responding to that foreign object.
In terms of what? Joint pain?
Yeah,
MS?
elevated inflammatory markers, everything from elevated CRP to true signs of a fatigued immune system, maybe a low white cell count we'll see after a period of time. It's, you know, when you embed something into your body that doesn't have your own DNA on it, you're going to have some kind of immune response to that. And some people can handle that well, but we would not encourage anyone who has an immune deficiency or a real immune challenge, an autoimmune issue. We would never encourage someone to have an implant with those sorts of situations. I think you're really bargaining for a bad outcome.
What if I had rheumatoid arthritis or lupus and I had an implant? Should you recommend to take it out?
That's a great question because, you know, when we remove the implant, we pose a whole new set of problems. What are we going to do so the patient can eat? So it's really an individual issue. And if we have, for example, a patient who can report in their history, you know, I was doing fine until I had these implants placed, then we have, I think we have some criteria to go ahead and remove the implants. Others may report that their symptoms began long before their implants were placed and nothing's changed. Well, that would be a different patient. Good question.
Yo les estoy preguntando sobre los implantes de titanio, de circonia, y la doctora Freeman me dice, todo lo que se meta en el hueso, el sistema inmunológico lo va a rechazar. A algunas personas les va bien, no sienten el problema, no van a tener ningún problema. Pero en otras puede representar un problema. Y el doctor Nunley dice, sí, puedes ver los marcadores de inflamación sanguíneos elevados. Yo le pregunto, ¿de qué hablas? ¿De lupus, artritis reumatoide, alguna enfermedad autoinmune? Y el doctor me dice, Nunley, inclusive puedes ver los leucocitos bajos, leucopenia, y eso es muy frecuente. It's very frequent to see patients with leukopenia. They don't know what's going on, and they just come back and forth from their doctors, and what is it that's going on, and probably in their mouth. Y el doctor me dice, mira, no, ciertamente todo lo que se ponga aquí como implante, el cuerpo lo va a rechazar. Circonia es mi recomendación si el paciente quiere ponerse un implante. Hay veces donde se puede poner un bridge, un puente, otra cosa, dependiendo de la edad. Si la persona es tall, right, and maybe it's at the back of the mouth and they don't need it, it's a 90-year-old. Depende de cada persona. You wanted to add something in terms of that, Doc, Nunley?
No, it's just that it has to be a decision that's made individually for each patient. It's because of the consequences. You know, when we never take this lightly, whether we're removing a tooth or removing an implant, because we know we're going to pose another set of problems. And so every patient has to be looked at individually. And
porque yo le pregunté al doctor Nunley, entonces, ¿qué pasa con un paciente que tiene una enfermedad autoinmune y tiene un implante de titanio? ¿Se lo quitas? Y el doctor Nunley dice, no tan rápido, porque podemos causar otros problemas. Es una decisión individual. ¿Y cómo va a comer la persona? O sea, Ludwig, not so fast. O sea, todo esto tiene... Todo tiene que ser puesto en una balanza y estudiar al paciente. Someone is calling me. They don't know I'm alive with you guys. I don't know. All right, so finally, let's go to an everyday daily thing that everyone can do. How do we clean our mouth? I mean, those gum bleedings and periodontitis or gingivitis. Is there anything else we can do home that? Okay, go to the dentist, have your dental cleanup and everything. But is there anything you recommend to do home? ¿Hay algo que ustedes nos recomiendan para limpiar la boca, además de ir al médico, pero esa sangre que tiene, gingivitis, periodontitis?
Yeah, there's some really simple things that you can do at home to increase your oral health and to decrease oral bacteria and keep things clean, and they don't have to be expensive. So when patients ask us what our favorite toothpaste is, there's some great natural toothpaste out there. The fewer the ingredients, the better. But the simplest thing that you can do that's effective is to do a combination of baking soda and a dilute solution of peroxide, and brushing your teeth with that. You can add a little salt. You can also make a paste with coconut oil and the peroxide and the baking soda, and you can add some essential oils if you like a little bit of a flavor. But it's that's a really simple thing you can do for toothpaste. And then one of the most effective ways that you can clean under the gum line and between the teeth is with a water pick with a dilute solution of hydrogen peroxide and water. And that's going to flush out things that your floss doesn't reach, that your toothbrush doesn't reach, and very effective.
La doctora me cuenta que puedes hacer tu propia pasta de dientes, puedes poner bicarbonato de sodio con baking soda con un poquitico de agua oxigenada y haces tu propia pasta de dientes. Coconut oil, right? It's also a possibility to use in your toothpaste to add coconut oil. Mm-hmm. I've heard about oil pulling, Dr. Nunley. Is there any usage in that? Le estoy preguntando si ponerse aceite de coco por unos 10-15 minutos en la mañana tiene algún sentido.
You know, there's certainly no harm in using oil pulling. I'd say some of the very healthiest mouths that I've seen over the years are people who oil pulled. And so they're removing some of the harmful bacteria when they oil pull. And so we would recommend it. There aren't great published studies on that, but still, I think it's a very healthy little adjunct to use.
Do you do oil pulling, Doc? ¿Tú haces oil pulling?
I do. I tell the story that, you know, inevitably when I'm oil pulling, when I'm jogging or walking, someone comes up to visit with me while I'm so they always think I'm spitting, you see. I have to get rid of the oil right quick so I can have a conversation.
El oil pulling es una técnica de durar 10-15 minutos con una cucharadita de aceite de coco comestible en la boca por 10-15 minutos y después la escupes y te enjuagas con agua. Yo le pregunto al doctor si él hace oil pulling. Él dice que una de las bocas más saludables que ha visto es la gente que hace oil pulling. Y yo le pregunto, ¿y tú haces oil pulling? Y él me dice, sí, cuando camino, troto, yo hago oil pulling. Y yo siempre he hecho el cuento, cuando viene alguien a hablarme, yo estoy haciendo oil pulling y tengo que escupir, es un desastre. And what about those mouthwash? ¿Y qué tal sobre esos enjuagues bucales that are out there? You know, alcohol, I believe, que tienen alcohol. Esos mouthwash that they give us everywhere. Que nos dan en todas partes.
So, like you mentioned, most of those commercial mouthwashes that you find on the shelf at a grocery store do have a lot of alcohol in them, and that can be really drying to your tissue, which completely defeats the purpose. And some of those stronger ones even begin to kill a lot of the good bacteria that we need in the mouth. So there are some good mouthwashes that are made by more natural companies that can be used if you just need a little refresher. People sometimes like that taste or that feel of having a mouthwash, but they're not really that effective as far as cleaning under the gum line. That's why you still need to use a water pick and just use a mouthwash more to just kind of refresh your mouth.
I'd rather go for the water pick that you just said, or the oil pulling thing. La doctora me dice que tienen mucho alcohol y son abrasivos para la flora, para la boca. What does that mean, abrasive in the oral flora? What would happen if you do that over and over? ¿Qué significa eso que sea abrasivo a las bacterias de la boca? ¿Qué ocurriría si lo sigues haciendo una y otra vez con ese alcohol?
Well, you don't want to nuke the oral microbiome just like you don't want to nuke the microbiome of the gut. And those mouthwashes that have high concentrations of alcohol do that. They're very effective at eliminating bacteria, but many of the bacteria in our mouth are essential to health, not just our oral health, they're also essential to our systemic health. We need a good microbiome of bacteria in our mouth, and we do not need to eliminate all of them.
Sí, el doctor dice, tú no quieres matar la flora buena que tienes en la boca porque la necesitas para tu salud. What about fluoride? Nuestras pastas de dientes tienen fluor, or the mouthwash when we go to the dentist. I think they give us this little glass with liquid to speed out, like to clean our mouth after a procedure, right? Does it have fluoride? I don't know. And then they clean your teeth with, is it fluoride again? I don't know. I'm just asking. Is it good?
It can be, and we would be solidly opposed to that, because fluoride is an incredibly it's the most active mineral on the entire periodic table, and the problem is it competes with so many other beneficial. I don't want to get too technical here, but for example, iodine is in the same family as fluorine or fluoride, and fluoride will outcompete iodine for the thyroid every time. So we don't want to introduce a toxic element like fluorine into our body when we're so dependent on iodine, not just in our thyroid, but in every cell in our body. So we would not be in favor of iodine.
El doctor dice que ni de casualidad el flúor, por favor. Él me pregunta, yo le pregunto que si es agua con la que uno escupe, que te lavan la boca cuando te hacen tratamientos en la boca o te limpian los dientes, tiene flúor. Me dice, podría tener, pero nosotros no recomendamos eso. Compite con el yodo. El yodo es importante para la apoptosis, es importante para la preservación de muchos sistemas en el cuerpo. Tú no quieres desplazar al yodo con flúor, por Dios, no. What about mercury? I got to talk about mercury. I mean, you guys promoted it. I mean, not you too, but Dennis promoted that, don't they? Le estoy preguntando sobre el mercurio. ¿Qué opinan del mercurio? Is it related to Alzheimer's? I mean, everyone's panic about Alzheimer's. Nobody wants to have it. Les estoy preguntando si hay relación con el Alzheimer, el mercurio, las amalgamas de mercurio que nos ponen en la boca.
So mercury is going to be really under the radioactive elements, one of the most toxic elements that we have on the periodic table. And so the thinking or the logic that they use to say that putting a mercury filling in the mouth is that when you mix mercury with the other components that could be silver, tin, zinc, copper, those things could be mixed with the mercury, that it somehow makes it safe, and that you can make it a stable component, and you put these fillings in the mouth. They call them silver fillings because it sounds prettier, but it's really, at least each filling is 50% mercury, and that mercury constantly comes off of those fillings for the lifetime of the filling. You release mercury vapor that gets absorbed into your tissue. You swallow small pieces of mercury. Those fillings expand and contract constantly over the course of a day as you chew on them and everything. So in regards to Alzheimer's, but a lot of other issues with digestion and with the thyroid and with other autoimmune issues, is that we know that mercury crosses the blood-brain barrier. It also collects in the gut. It can cross the placenta of a pregnant mama, and it can also show up in the breast milk. So it goes everywhere. It also collects in the cells. And so that's why we do not like mercury fillings. And when we take them out, we need to do it safely so that somebody doesn't get a huge dose of it.
La doctora dice que el mercurio, bueno, es una neurotoxina y que ciertamente el razonamiento ontológico es que ahí no hace nada porque se mezcla con otros metales y se va a quedar ahí y no va a ser tóxico. Pero la verdad es que se libera con cada mordisco, con cada té que te tomas, con cada café, cada taza caliente, se libera y se riega por todo el cuerpo, se riega por todos los órganos y cruza la barrera hematoencefálica, llega al cerebro, y no solamente Alzheimer, con muchos problemas en el intestino, está relacionado con cáncer, con muchas otras cosas. Así que, y dice la doctora Lane Friedman, hay que removerlo de la forma segura. Hold it there, I don't understand what that is, because I had mine removed back then when I was like, I don't know, 20 years old. We took them out the easiest way. It was a beautiful day. Boom, boom. I just have beautiful teeth back. Y yo le estoy diciendo, un momentico, no entiendo eso de que sacarte las amalgamas de forma segura. Yo me las saqué hace 20 años, me la quitaron, me pusieron resina blanca, yo estaba good to go. What do you mean by that? Safe product.
The safe protocols means that in the same way that mercury comes off of a tooth just daily, you can imagine that if we put a drill in there and we start drilling away like they did for you, the patient's going to swallow all of that, inhale a lot of that mercury vapor, and they get a huge dose in their systems. And I've had many patients that have told us that they just, went to a dentist that just took it out real quickly and it was easy, but they felt sick for days after days, weeks, months, sometimes really had some long-term effects from that. So the protocols we use would be to protect the patient from swallowing or inhaling that. We have a lot of protocols that, physically protect the patient, like a rubber dam and a lot of suction and water, along with the vitamin C.
There's a lot of people listening now, and they're thinking, I'm going to take these out tomorrow. I don't want to have Alzheimer's or any of that. But now they're like, whoa, what should you do then? Should they wait, find a dentist just like you guys, or should they take it out, telling them, hey, do it cautiously, cut the whole piece and take it out, don't do the whole, what's your take on that?
I think the safest way to do it is to find a dentist who will follow those protocols. And there is a certification process for dentists in the United States, but internationally also. It's called the SMART protocol through the IAOMT. And those dentists have done the training and they promise to take mercury fillings out using those protocols so that their patients don't have to wonder if it's being done properly or not.
Yo le digo que hay mucha gente oyéndola y diciendo, mañana me voy a sacar esto. Y después dijo, no, como que no, porque si se me riega, ¿qué deberían de hacer? Pedirle al odontólogo que lo saquen una sola pieza. Y me dice, deberían de buscar a un médico que pueden conseguir en la IAOMT.com que esté certificado en el protocolo seguro. Existen, IAOMT.com. And my final question, I leave you guys. I love you. Thank you for all your time. Y mi última pregunta, y los amo, gracias por haber estado por el tiempo. There's a lot of dentists. Hay muchos odontólogos watching this right now, oyéndolos. They came here, vinieron, because they want to learn from you, porque quieren aprender de ustedes. And I know that to be true, y sé que eso es verdad, because they have DM'd me, sent me private messages, me han enviado mensajes privados por Instagram, diciéndome, telling me, please, Dr. Johnson, how can I learn more?
Yes.
What can I do? How can I contact Dr. Nunley? How can I know more about Dr. Lane Freeman? ¿Cómo puedo aprender más del Dr. Nunley y Lane Freeman? Because I've seen what's happened with your patients, porque he visto lo que ha pasado con tus pacientes. And I gotta tell you, I honor that so much. You gotta know the heat that I've gotten to all this. Y yo les digo, yo honro muchísimo eso. Tienen que entender el fuego que yo he recibido con esto. As you can imagine, there's a lot of people that are not happy with all these info. Como pueden imaginarse, hay mucha gente que no está feliz con toda esta información. Is there an answer for them, Doc?
There is. I think there are some wonderful training programs through the International Academy of Oral Medicine and Toxicology. That's IAOMT.org. And so dentists can go to that website, and there are many, many tutorials on how to do this sort of dentistry. And that's where I would encourage the dentists who are watching tonight to start. They'll really get a good foundation in the basics.
Should everyone, Dr. Lane Freeman, do a cone beam?
I think it's the best way to see exactly what's going on. A two-dimensional image only shows us so much, but a cone beam x-ray shows us exactly what's going on in the bone, where you've had other extractions around every single tooth. We can look at it in detail in 3 dimensions. So I think it's the best way.
You guys definitely don't watch Super Bowl, do you? Yo les acabo de preguntar a los doctores cómo conseguir educación, información sobre ellos, porque hay muchos dentistas que quieren esta información. Y me dicen iaomt.org. Ahí hay muchos tutoriales, muchos seminarios, mucha información donde pueden aprender todo esto. Y le pregunté a la doctora Lane Freeman, ¿debería todo el mundo hacerse un cone beam? Y su opinión es, todo el mundo debería hacerse un cone beam. Es la mejor forma de ver lo que está pasando en la boca. Thank you, Dr. Nunley. Thank you, Dr. Freeman. It's been a wonderful, wonderful hour with you two.
Thank you, Dr. Johnson. It's a privilege for us to see your patients and to get to have this time with you.
Absolutely.
Bye. See you soon.
Thank you.